Cancer Holistic Guidance, Part 31. Dr. Dilip Gadgil, Pune. So, I was talking about stress and depression as factors that worsen the patient's condition, eventually leading to death. In Ayurveda, fear-inducing elements are considered the worst. When the patient and their family feel like they are incapable of doing anything, when doctors give up hope, when death is inevitable, it leads to depression and subsequently, death. It is important to understand how to deal with this. And that is why we have a counselor on board. Finding out the reasons that are causing depression within a patient is necessary. The main worry in most people is what will happen if they die early. What about the family? What about my dreams? What about finances? From a patient's perspective, these are some of the biggest worries. If the patient is a high-earning member or sole breadwinner, it becomes an even bigger concern. In the case of a non-earning member, at least you know that the family's income won't get affected. I have written about this subject in my books, including how to control stress from the patient's point of view and how the family should approach such situations. Instead of thinking, can I recover from this, the patient should think about how they can get better. If the thought process is right, you can work towards it. In that case, there is a better chance of finding a way out. Our mindset is based on what the doctor tells us. But there are examples of people who have emerged victorious from their battle with cancer. Talking to such people or their families can help us understand the right approach. Ayurveda and homeopathy are termed as alternative approaches, but if you think about it, they are not really alternative sciences. Ayurveda, especially, has been around in India for thousands of years. However, ever since modern medicine became mainstream, Ayurveda started being looked at as a secondary science. It is important to remember that Ayurveda is not a lesser science. It is a fantastic science and should be sought for the treatment of cancer. If this is the thought process, then it will be possible to deal with cancer better.